my knowledge, I think we are the largest team, the policing mental health and outreach team within the RCMP, and perhaps even the country. And we specifically select our officers who show a compassion for this type of work, who want to work with vulnerable clients, and right down to the specialized training we provide them, the vehicles that they are in, the uniforms that they wear. They have a really compassion-based outlook on policing and really want to help the community. The clients that we deal with, they could have a multitude of things that we need to be mindful of. Some of them can be suffering from mental health concerns, addictions, and substance use. So it's very important for our officers to understand what that means.
The partnership with Fraser Health and having the psychiatric nurse present really provides us more information as to whether a person needs to be apprehended or not. At a very base level, all officers have the authority to apprehend under the Mental Health Act, and basically they just have to observe that the person likely has a mental health condition and could be a danger to themselves or others. But sometimes just relying on those three doesn't give you the full picture. A lot of times what the nurse can do is actually help us prevent taking people to hospital and making referrals on an outpatient basis through the community.
I think with Car 67 arriving on a scene as a nurse showing up to a call, the one thing that we're able to do once we do get to the call to deal with the individual in a crisis is we can slow things down. So I think that's quite key to a lot of people in a mental health crisis. They're very excitable, they're very confused, they're very agitated. So apprehending somebody under the Mental Health Act, we're taking away their rights. They're not arrested, they're apprehended. It's traumatizing for some people. Some people are confused, some people have never been apprehended before. Again, and I keep saying we slow it down, but it helps them, right? Because they have to be put into handcuffs for the safety of them, for the safety of us, for the safety of the back of the police car, and for the safety when we arrive to the hospital, for the nurses and the staff that are there. We don't know these people sometimes. They can be unpredictable. A lot of people can be quite calm, and then the minute you change their environment, whether it be into the police car or into the hospital setting, then they can become agitated. So we have a role to keep everybody safe until we know that that client is going to be okay and is safe where they are.